we're here to talk about your podcast because you were going to start a
Yeah.
podcast. So first off, just tell me, a little about yourself, who you are,
Okay.
and what your plan is.
I am a medical student. I just started my third year, and I've been studying medicine, whether that's medical school or pre-medical school, for about 8 years now.
Mm.
And it's a very long period of time. And I kind of wanted to start getting into different things, not just as an outlet, but to merge it with medicine. And I thought starting a podcast is the best way to do that. Just not to talk about my life, or not just to interview doctors, which is a great idea, but to also just talk about mental health.
Mm-hmm.
Talk about how it really is, not in the hospital, but outside of the hospital, because it's a tough field. And so, yeah, I'm a medical student who's just taking her first steps into this world.
Well, it's interesting how nowadays real stories from real people get real results, as opposed to a lot of what you would see on like TV or like news coverage about the medical field. It's filtered, right?
Very.
It's very filtered.
Very.
In a podcast, it takes that filter away.
Yep.
Like one of the big benefits is there is no FCC, right? The FCC regulates all of TV and film based on the certain guidelines, and then with TV, even at the local news, what have you, it gets filtered through advertisers and their donor and people who fund them. Podcasting doesn't exist. The only filter you have is your audience. The only filter you have is yourself. So, what is your plan? So you want a medical podcast about mental health,
mainly, yeah.
So how are you going to take that filter away?
I want to talk about on my first episodes, definitely. I want to talk about how we get into the medical field and how a lot of us are conditioned to think a certain way, to act a certain way, to compose yourself a certain way, and the effect that had on my mental health. And a lot of us are told that we can't do this right now because we're supposed to be studying. This might not even be seen as professional to some doctors. And what I plan on doing...
It won't be. Definitely not.
Yeah. I plan on just kind of talking about the things I went through. And if people can connect with that, that's a great thing. But also talking to other students. I had a very rough last 8 years in this field. And the only reason why I didn't give up is because I loved it so much. But I see a lot of my friends starting to give up on it because it could get very depressing. You don't really hear and see people that are going through what you're going through. On social media, if there's someone posting about their life, it's very edited. It's very much so, I mean, in a good way, like they're trying to inspire you, but no one really sits down and says, man, so tell me about your life, because it's so dark sometimes. All you do is study. You're told you can't have a social life. You're told you can't do other things because you shouldn't be. You should be devoted to medicine because it's a very long journey. And I'm just here like, well, we could still be devoted to medicine and jump on a podcast and talk about it.